With doing sleep apnea and discovering more about sleep apnea, I always wondered, seeing adults and they have these problems, I always wondered, there's got to be a way that we can stop this or correct it or help it so that as an adult you don't have to deal with the snoring and the bad sleeping. And so through a lot of research and looking at different things, there are options out there. So one of the things that we do is when we see the kids, young kids, we believe that early detection is the best thing to do. And so when kids come in, we look at their airways, we look at in their throats, we look at tonsils. We take a cephalometric x-ray, which is an x-ray that shows the side of their head, shows their airway. We can look at tonsils and adenoids, and if a kid looks like they're grinding, their teeth are small, the mom comes in and says, hey, why are my kids' teeth ground to little nubs and not there? Those can be signs of sleep apnea or sleep disordered breathing in kids. So we look at that. We look at the grinding. We look at the shape of the jaws. We look at if there's spacing for teeth. If there's not spacing for teeth, their upper and lower jaws aren't developing the way they should be developing to give us that space. And so we look at those things, and we come up with ways that we can help develop that airway. It may be a trip to the ear, nose, and throat to have tonsils and adenoids looked at, to evaluate it, to potentially be removed, to open the airway so that they can breathe. It could be that the child needs to go see a myofunctional therapist, which is someone who deals with, positioning of the tongue and proper swallows and placement of the tongue. It's early orthodontics, it's expansion, developing the upper and lower jaws so there's room for the teeth, so permanent teeth don't have to be extracted. We believe that a kid should keep all their teeth, all their permanent teeth. And so early detection in kids is really important to us. As a father, having 5 kids and seeing these things in my kids, seeing the smaller airways, getting the tonsils and adenoids removed, and starting to do some expansion, making the jaws bigger. Those things are important for me as a father, and I want to give those things to our patients too, to our young patients. When patients come in and they have symptoms or they're told they have ADD or ADHD, a lot of times those symptoms are the same symptoms as a child who has sleep disordered breathing. And so it may not be that they need to be medicated. It may simply mean that we need to give them an airway. We need to help them breathe so that they can be successful, they can do well in school, they can have great minds, they can think, they can learn and become successful.